Okay. Hi, everyone, and welcome to Kids in Mind, a webinar series to support families during the pandemic. My name is Professor Adam Guastella, and I'm the Michael Crouch Chair in Child and Youth Mental Health. And today we're talking about pregnancy and the pandemic and supporting families during pregnancy as well as in the first weeks of life for newborn babies. This coming Wednesday, we're going to be talking to Tracy Considine from the Canterbury Public School and Hugh Miller from Stanmore Public School about transitioning back to school. And next week, we'll be talking about parental decision-making with Chin Chen and Betty Cha. But for today, there is no doubt that families who are falling pregnant are getting a very different experience of the pregnancy process than what most people are used to in Australia. There is, of course, the impact of COVID directly on families and mothers that are pregnant, which is causing worry for many. But there are many indirect effects. There's the social isolation, the limitations on gathering, the difficulty for hospital appointments, and if labour wasn't confronting enough, fears of what might happen to families in the hospital. And then when families finally get home with their newborn baby, there's restrictions on the number of people that can come and help and support the family in the first weeks. So to talk through some of this impact and to talk through some of the difficulties families are having, I'm welcoming Associate Professor John Keogh, a gynaecologist and obstetrician who's worked in many countries, Sydney, England, Dublin, Tanzania, and been head of department at Hornsby Hospital, overseeing the delivery of thousands of babies. And John has also co-founded the charity My Sister's Baby, a charity focusing on supporting families in pregnancy from low and middle countries to provide access for free healthcare. Welcome, John.
Hi.
And I'd also like to welcome Professor Nadia Badawi. Nadia barely needs introduction. She is a world-famous neonatologist, the medical co-director of the Gray Centre for Newborn Care at Westmead and the Foundation Research Chair of the Cerebral Palsy Alliance. She was selected as one of Australia's 100 women of influence, but most importantly, she's a person that absolutely cares about her patients. And one of my favourite memories of Nadia is whenever work's getting hard or we're not seeing a way forward, her favourite line is, "Adam, you've always got to think of the family." And that's Nadia to a T. So today, welcome Nadia.
Thank you, Adam.
I'd like to actually start by asking yourself, John, you know, you're seeing many families are falling pregnant and going through the pregnancy process. What are the worries for families that you're seeing during this time?
You know, Adam, I think probably the first and foremost worry people are experiencing now is that they feel that they're doing this in a much more isolated environment. They don't have that bevy of supports they used to have around them. They can't get access to their families coming and seeing them, both antenatally and even when they've had the baby. They don't have the same supports because families are not able to come in and provide that support like they used to. Women, when they come to the clinic now, are coming by themselves. They're not coming with a partner unless there's something really important that needs discussion. So we're doing a lot of zooming in of or FaceTiming of partners during visits. It's not the same. It's just not the same. And even the joyful experiences of pregnancy, like going to an ultrasound scan, often now there's just the mother is going in, and so they don't have all that family support and all that wonder of seeing the baby for the first time. And I remember it being a very ooh and ah experience, and probably the first time I, as a man, really understood that this was real and that it was not just some nebulous baby, but that was my little girl that I was looking at. So I think there's a lot of loss that people are feeling. And then on top of that, there's the fear. People are afraid. They're afraid both of what might happen to them, of what might happen to their families, of how it might impact on the baby, but also they're afraid because it's unknown and unknowable. And there's so much misinformation that there has been a campaign of fear that has been spread through the media and through social media.
What is that campaign of fear you're talking about? Because it's probably the last thing that people need right now.
Well, for instance, the fears that were put in around the AstraZeneca vaccine. You know, the disproportionate emphasis was placed on the clotting disorder, you know, where instead of talking about one person in the Melbourne cricket ground, it felt like it was likely to happen at any moment. And then there's been enormous misinformation that's been placed out about the vaccine in pregnancy. And I am spending a lot of my day trying to counter that. And people have very entrenched ideas about it that it's hard to know why they feel so strongly sometimes, you know, why people are prepared to say, well, I'm prepared to lose my job, I'm prepared to, you know, rather than have this vaccine, when they don't feel that about other vaccines. They don't feel about it other, it's just oddly disproportionate in some ways.
So, I mean, for pregnant mothers, there is, I've heard a lot of concern about the vaccine in pregnancy and potential harm to babies and harm to themselves. What is the evidence around the vaccine use in pregnancy?
Well, look, the problem was that, as often happens with drug trials, pregnant women were excluded during the randomized trials. And so it is true that we do not have randomized data relating to the outcomes of pregnancy in women who have had the vaccine in pregnancy. However, there has been, and this is what's happening more the time in living guidelines and things like that have been developed, that we're being constantly updated. There have been around 200,000 women now in both the United States and the United Kingdom who have had the vaccine during pregnancy, and they are being followed up. Now, the follow-up is not complete, and often people talk to me, they say, but have all those people delivered? And obviously not. This is a vaccine that's only been around, you know, since January, I suppose. I had my first vaccine in March, and I was early, so it's not been around for very long. So a lot of the people who have had it in pregnancy have not yet delivered. However, there is much to be reassured by in the vaccine. For instance, there's no increase in was a decrease in stillbirth, but there's no increase in adverse outcomes for babies in the third trimester, or there's no increase in preterm birth. There's no increase in miscarriage. There is no increase in growth restriction. And you can't say that about the virus. The virus causes a significant increase in all those things, including preeclampsia and growth restriction and stillbirth and mothers getting sick and getting into intensive care and needing ventilation. And so the problem we have here is that the virus is real and its impacts on a pregnancy are real, and they're palpable and they're being felt by families all over the world. The fear, unfortunately, that has been created by the misinformation campaign relating to vaccines is also real. That fear is real, but it's not based on reality. It's based on, I don't really know what the motivation is. I cannot tell you what the motivation is. But it's really important to understand that there is no realistic mechanism by which the vaccine could hurt the baby. You know, it's only in your body for a very short time. And all it's doing is stamping a memory on your immune system that says, I know what this protein is. Next time I recognize it, I'll know what to do with it. There is no ongoing process other than that stamping of the immune system from the vaccine. It doesn't stay in your body. So you can't say, can I just say one more thing? And it is, we can't say that about the virus. We do not know what the long-term effects of the virus are on babies. We do not know whether or not this is going to affect their development long-term. We don't know what the impact will be on autism or cerebral palsy or intellectual problems or mental health in future life. And we know that there is a long COVID aspect. So we know that at least in adults, it can have a long and lasting impact. But when people are worrying about the potential effects of the vaccine, they need to balance that against what are the unknown long-term potential effects on the baby.
I'm wondering, John, you see, lots and lots of families with COVID. What are some of the stories you hear from families in terms of their concerns and worries about the process at the moment?
Well, I think, obviously, for any family, when they go into a pregnancy, the priority is the well-being of the baby. And to be honest with you, that becomes the most important driving force during a pregnancy, even more than the well-being of the mother, to the mother herself. I'm not saying to the rest of the family, but to the mother, I see them constantly putting their own needs second to that of the baby and taking actions that, like, where people need to come in for prolonged bed rest because of some problem, or have to stop work very early, even though it's got significant financial implications. They always do that because the well-being of the baby is paramount. Now, here you've got this fear of what might happen to the baby, and also what might happen to them, and whether they'll be there to look after the baby at the end of all this, and I think that's, look, we have been very lucky in Australia up until now. The first 2 waves of the virus really didn't have a big impact on pregnancy, but this Delta wave, it's really very different. It has a significant impact, and like influenza, it's picking pregnant women. It is affecting pregnant women more than the non-pregnant population. So if you're pregnant, you're more likely to get the virus, and you're more likely to get the severe form of the virus. You're more likely to end up in intensive care, you're more likely to be ventilated, and you're more likely to have adverse outcomes for the baby. And of course, that is devastating. And that is why I think there's been such a fabulous uptake of the vaccine. And I know in my patients' population, I would say at the moment about 95% of them had their first dose. And I would be able to count on one hand those who are saying, look, I don't want to do it.
Okay. That's reassuring in many ways, John.
Yeah.
Can you talk through what is the process at the moment of having a baby, that's different now, or what mothers are experiencing in a different way?
Well, I think for people who are coming from low-risk areas, it's not that different. So for instance, if you I work at the Sand Hospital. If you're living in Turramurra, where 90+% of people have had their first dose, then you're probably having a very similar experience to what you were having before, in as much as you can't, it's true, all those things we mentioned before, your partner can't come to the visits or the ultrasound and things like that, but he certainly can come to the birth, he can stay with you while you're in hospital, and he can come and go. If you come from a high-risk area, one of the LGAs, or if there's a possibility you may be exposed, then you have a very different experience. Suppose, for instance, someone comes into the hospital and they've been potentially exposed. Maybe they're a potential contact, or even if they come from a high-risk area but haven't had a test in the last 3 days, they have to be met in the car park by nursing staff in PPE. They have to be dressed in full PPE. They have to be taken by a dedicated lift up to delivery suite, where they are then put in a room which is isolated. As they come up, they have a cleaning team and security with them, and the cleaning team is cleaning behind them. Then they're in PPE in the room until they can have a rapid test which shows that they're negative. That's the first couple of hours. Once that's negative, okay, then they can labour, but they have to stay in that room. They're not allowed to leave it. The husband's not allowed to leave it. And when they move down to the ward, the husband can stay, but he has to stay in the room, can't go out of the room. Now, I don't know about you, but 4 or 5 days in a hospital room with a newborn baby where you can't leave but have to go to the door and try and attract the midwife's attention for anything it's a less than joyful experience. Now, there are some good things about this, and one of the good things, and this is going to sound a little terrible, but it's true, is that people have not been as upset about not having visitors as I would have expected. In fact, I would say that we'll have to rethink our whole visiting policy when this is through, because women have been loving the fact that they're only having their partners, and they would be completely happy if they could only have their children come as well, but they can't have the children come at the moment. Right. But so they can only have their partner. But in fact, that has had some good things. We're seeing mothers having much more time to spend bonding with the baby, much less concern about breastfeeding. You're not worried about your husband's work colleague popping in the middle of your breastfeeding and just started looking at you awkwardly and not knowing exactly who you are, but felt he should come and visit you because you're his mate's wife having a baby. So there's a lot, and there's a lot of before where people were getting the baby was being handed around from person to person, and by the time mum put it back on the breast was quite unsettled, you know. So in fact, in some ways, there's been some good things about it, but you know, really we're seeing people try and get out of hospital earlier too because they're really missing their other children. And the other children are really missing them, and Zoom just doesn't cut it when it comes to giving a child a cuddle after a birth.
Yeah, we've certainly had a lot of discussions about Zoom, but the you know, I've always thought that this pandemic would make things a lot more stressful. What's amazing here is you're actually saying that for a portion of the time at least, it's giving people a bit of a break to be able to focus just on their baby.
Yes, yeah, very much so. That's been sort of almost universal, that feedback. Yeah.
I'd like to move maybe to Nadia. Nadia, you're seeing babies obviously in the NICU, but throughout the hospital. What's the difference when babies are born? What are you seeing that's happening different during COVID?
Look, we've learned so much too, Adam, during the process. When COVID started, we were really worried that the babies would get infected from the mothers. And there were endless discussions about whether babies and mothers should be separated. But actually, there's a lot of evidence now that the benefits of keeping the mother with the baby, that's not if they're not in a NICU, is probably best. So even if the mother is positive, it's best she keeps a mask on, but she breastfeeds the baby skin to skin. And I've been talking to a lot of families. I'm sure you heard from Phil, there's about 2,500 positive children who are being cared for in the community by the hospital, so hospital at home. And there are a lot of babies who are positive. And overall, they're doing well. The parents, of course, are very anxious, but overall, the babies are doing well. Now, when it comes to being in the NICU, it's a totally different experience. I work at the Children's Hospital at Westmead, and we've always prided ourselves on being a family-focused unit. Parents come in anytime, handle the baby, skin to skin. But COVID really shocked us. And I think it made us feel like much worse health professionals. We were questioning what we were doing because in the beginning, what we value ourselves as being humane. And a lot of our nursing staff in particular were just really horrified at the thought that we would limit visiting. So we've had to contend with having only one parent at the bedside, and we are allowing a 15-minute crossover. Grandparents who haven't seen the baby, siblings. And I mean, I remember once at the beginning of this, I had a baby who'd been transferred from another unit, and she'd been in hospital for 5 months. And I said to her parents, "Oh, what do her sisters think of her?" And they said they've never met her. And I was absolutely, I was horrified. I've been doing this, as I said, for a while, and I was so taken aback. But we found a window of opportunity, got special permission, and they came in to visit her. And I thought, I mean, I'm not a psychologist, but what's this going to do, this 5 months separation for those siblings as well? Because here is this newborn baby who's stolen their mother away for 5 months. And I don't know, that's going to need a lot of thinking. I think too, the parents, they're worried. We're clearly tense. The health professionals are worried. We're less worried now that we're vaccinated. But we've had, in the last couple of weeks, we've had positive parents in the unit, COVID positive parents. And that's meant that 6 of the nurses have ended up being furloughed. Neonatal ICU specialized nurses are gold. So when we have to put 6 of them at home, that means we're short-staffed.
Yeah.
So the implications of this are widespread, which is why the vaccine has been amazing. I mean, we have 100% vaccination rate in our unit.
Yeah.
And that, I think, is because the staff wanted to be able not to infect parents, not to infect babies, and to keep their own families safe. And of course, in my unit too, we have a lot of young mothers and a lot of young nurses who are planning on getting pregnant, and they've had the same worries as the community. Is the vaccine safe? Does it affect fertility? And we've had those discussions. Those worries are real. And I think it's a real testament to the staff that it's 100% vaccination now.
So Nadia, I mean, this is extraordinary. The stories you tell, the stress you must be under, and the unit. I'd like to know how you're coping, and what are the strategies that you think work when you're coping with these high stress situations?
I think it's about having open conversations with my colleagues. There have been a lot of tears over the visiting policy. I have to say, my amazing nurses, they were literally in tears at the idea that we would be separating parents and babies. And we've come to a really good compromise with the hospital. Parents are wearing masks, hand washing. Our parents are agreeing to be tested every 3 days to make sure the staff and other babies are safe. They don't have to do it, but once they've had an open dialogue with us, and I think that's what I think it underlies success here. It's being respectful, being honest and open, and being accountable. So we tell the parents, this is our dilemma. And they have really, I said, I can't force you to have a test, but you know, we haven't had a single parent refuse that. And they've come and said, look, actually, I'm not feeling well. They'll ring and say, I won't come in, I'll go get a test. So I think the community get it if we're honest and we share the problem. My colleagues are amazing. We do debrief. We've talked to each other about how hard this is and how scared we are for our own families. Nobody wants to take this home. I think that's all I can say, is that to remember why we're there and to support each other and to be open about it.
So you talk about the bonding process in the first months of life. Can I ask about mask wearing, and do you see any sort of difference in babies coming through with the mask wearing in terms of their...
So I would say, just from my point of view too, with the parents, it's very hard when you're trying to communicate, as you can imagine, in a stressful situation. And we're there with masks, trying to talk about a baby going for open heart surgery and preparing the parents. And we're very, you know, I think tactile. We try and hold a parent's elbow, they'll hold ours. But now we're having to keep 1.5 meter distance. I find that very hard. My colleagues are finding that hard, comforting families who are struggling. And also the masks get between us and the family. So I've had some parents who've been hearing impaired, and the masks are just a disaster because they can't see what we're saying. And, you know, I know that, you know, John was saying that having babies come back for a visit, I'm sure John will elaborate, and you felt they were different, didn't you?
Yeah, I certainly noticed that because we bring all our babies back at 6 to 8 weeks and see them again with their mums. And I think that there's just, and look, this is probably going to be reversible and stuff, but it seems to me that babies really respond to your face. They look at you carefully and then they break into a big grin and they smile. But now they can only see my eyes. And I don't know if they can tell whether I'm smiling or not. They can tell my chatter. They can tell by the tone of my voice, which is probably driving them mad. You know, but certainly it seems to me they're not smiling as much when they come for their 6 to 8 week visit. So I am really emphasizing to the parents that they have to compensate for the fact that they're not getting as much of that in public by spending a lot of time in close conversation with their babies, not wearing a mask, obviously, because, I mean, this is parents at home in a safe environment. So I'm telling them it's important to read to their babies and and let their babies see their facial expressions and arrange them, because I do think they're not getting the chance to see that in public anymore.
Sure. I mean, it's entirely possible that it's a simple habit with masks being on faces and people, you know, the mouth is such an important feature to describe emotion and intention that, you know, it's just a habit that will develop once masks are off. But what are the, I know that the hospital and researchers at the university are thinking about how to, you know, alter that process. Could you talk through some of the strategies that you're thinking about in terms of changing traditional mask wearing?
So there is a research project happening where I think a student at Sydney Uni is trying to develop a transparent mask for people who work in pediatrics. Right. And I think that'll be fantastic. And I'm not the only one. Even my surgical colleagues are talking about how their children, when they're talking to them about surgery, the children in the hospital are finding the masks a big barrier. And also children themselves over the age of 12 are now required to wear masks. So I think that's going to be very valuable to have transparent masks. Right. Now, there are a couple of questions in the chat, and one of them was about, is it safe to breastfeed when a woman is vaccinated? And absolutely, and we encourage it. In fact, so there are two things. For women who are COVID positive, we want them to express. I have two amazing lactation consultants in the unit, and they are collecting expressed human milk from mothers who have children in the hospital, and they are hand delivering it to those babies. And even more importantly, if a woman is vaccinated, yeah, there's absolutely no evidence that the vaccine is at all deleterious.
Okay, thank you. And there is a second comment, and just, I'm not sure if I said to people, but if you have any questions, to put them in the chat and we can see them. For those kids being cared for in the community, how do families manage that process? And what could people do to support a family in that situation?
Yeah. Look, it's very difficult. I have been speaking to a lot of the families we have an amazing outreach team, and I do a few hours a week. And first of all, most of the families come from, a lot of them are coming from non-English speaking backgrounds. And because I am bilingual Arabic English, I can speak to those families, and they are really struggling. There's often 4 or 5 kids in a small apartment with grandparents. I ring and there'll often be a parent or a grandparent who's actually in hospital with COVID. And I've been amazed about what the hospitals are doing. So if they're short of food, it gets sent out. If they're short of supplies, masks, those are sent to the families. It is very hard because we are already, as you know, Adam, I don't need to tell you, very short of mental health support.
Yeah.
And I don't know what's going to happen after this. We've even running out of medical interpreters because they're so busy. So I think not judging those communities. I have unfortunately heard, it's a minority, but people are judging them a bit. And I think that's unfair when you talk to them and hear their circumstances, and you realize most of them don't know how they got the virus. And this Delta variant, if one person has it in the household, it's through the household.
Yeah.
So, and
Nadia and John, I mean, listening to you both talk, I have to, I mean, you see the worst of cases sometimes, particularly yourself, Nadia, and I'm, you know, I'm feeling a lot of negativity in terms of what's going on in the current climate, but I'm assuming most pregnancies are going okay and most people are getting through without any problems.
That's absolutely true. And in fact, we're in the middle of a boom of babies. We're really busy, people having babies. And of course, for the most majority of people, it's going super well. And even when people get COVID, it's very important to understand that although the risks increase, most pregnancies will do well, even in the presence of COVID. It's really about, you know, we have got so used to pregnancy being so safe in Australia, quite different to where it is many places in the world, that for us, almost all risk is unacceptable. Do you know what I mean? And really, no one doesn't expect to go home with their baby in their arms at the end of a pregnancy. Even though there are still real risks, they have been minimised, and it really never has been safer in Australia to have a baby than it is in 2020s. Now, COVID aside, that's the truth. Now, COVID itself adds another layer of complexity, but again, most people who have COVID will do well, but then they do have to be watched. They have to be watched closely, and of course, there is this potential for decompensation during the pregnancy. And I guess, you know, it's really become another pregnancy illness, but this one that, you know, unlike some pregnancy illnesses, there is a clear strategy for how to avoid it, you know, and that's the immunization pathway, and following, I suppose, the general rules of social distancing, hand hygiene, mask wearing.
So can I ask, you know, seeing the plethora of experiences that are going on in the community right now, you've mentioned vaccines are really important to reduce risk for the baby and for the parents and the family as a whole. Mm-hmm. What other strategies do you recommend families utilise at the moment, particularly as, you know, we're talking about the community opening up, kids going back to school? What are sort of the things that are going through your mind at the moment in terms of how families should be supporting their family at the moment, or how parents should?
I'm sure Nadia's got something to say about that, but just if I could just say something first, and that is that, you know, most of the women that I'm dealing with are very actively isolating in the final weeks of the pregnancy. So from about 36 weeks, they're really not going out very much at all, even without lockdown, even prior to the lockdown being there. They're staying at home and they're really minimizing social contact. And the problem is, of course, it's just a small breakdown that can be a problem. I have one patient recently who had to look after her sister's child because there was no option. And that 10-year-old came across, and 2 days later, he had COVID, which meant that we had to delay her Caesar. She had to be swabbed every 3 days. You know, so you would have thought, oh, the 10-year-old's not going to be a real risk, but he was. So these are the problems that people have. They have to actually really, especially in those final weeks of the pregnancy, really be very careful and follow those basic rules of distancing, hand hygiene, mask wearing. And of course, the risk to them can be modified by immunization, but it's not the only strategy that you can have from that.
2 questions. There was one about whether pregnant women might be interested to know if there's a difference in the level of risk of the vaccine to the unborn baby based on the stage of pregnancy. And no, isn't it? It's safe anytime, as soon as a woman knows she's pregnant, right through to the end.
It is safe. In fact, it's safe in anyone who is wanting to progress to fertility. So even people who are getting ready for an IVF cycle, we're still recommending they have the vaccine. But the main risk to the mother actually is in the 3rd trimester, because that is when the mother's own respiratory system is already compromised by stiffness in the lung wall, in the chest wall. The heavier breasts make it a little bit harder for them to breathe. The diaphragm is being compressed from below. So they already have decreased respiratory reserve at that time. So that's why the 3rd trimester is particularly risky to pregnant women who get COVID. And that is why we're really trying to prioritize getting the immunization in the first 2 trimesters, so they're fully immunized by the time they reach the 3rd trimester. Right. And can I just say one other thing about the vaccine, and that is there's been a lot of stuff about whether the vaccine might affect fertility. And can I say, first of all, that no vaccine has ever been shown to have any impact on fertility, and there's no mechanism by which this could have an effect on fertility. There's been a lot of information, I'd say misinformation, about lipid concentration in the ovary. The dose that you're getting in the vaccine, you can see how small it is was put into you. It's got to be distributed right throughout the body. There's no way that a lipid's going to be a problem in the ovary. And remember, the ovary is made of lipid, and it can just metabolize that. So again, there's no impact at all on on fertility. That's really important because I get a lot of questions about that.
John, I mean, just thank you for sharing your expertise around that. Why has it, I mean, I've heard of this fear. No one's ever said it so clearly and straight as you just did. Then why aren't people saying it straight like that?
This is not new, this anti-vaxxer field. I mean, you may remember that down in Melbourne, there was a thing where people who feel very negative about vaccines were wandering around, putting up posters, taking down the posters in hospitals and saying, putting up posters saying vaccination is like rape. That was the posters that were being put up in hospitals. But so there are a group of people who feel very strongly about this, but they don't just feel about themselves. They're quite evangelical about it. And I don't understand the mechanism, the motivation. I don't pretend to understand it, but it is, it's a real subsection of the community, and it's really come out in the COVID.
But attitudes are really changing. I went around the NICU yesterday because there was some spare vaccines for parents. They'd all, apart from one person who said she was not going to get vaccinated, they'd all already started to get vaccinated. People's attitudes have changed, and they're changing.
So
I wanted to add one thing, because I think it's important, again, is that COVID, when a woman is COVID positive, it increases the risk for preterm birth. And I think that is important for people to know, because prematurity is risky for babies, as we know. You know, you spend time in a newborn intensive care unit, and it's a risk factor for neurodevelopmental conditions. So I think, such as cerebral palsy, autism, and I think it is important for families to be aware of that. And there was another question about New South Wales opening up. Should families be worried? What do you think? I mean, I think it is a risk.
Is that to me, or is that to, I was going to ask you the question, you and John.
You can ask for them.
Yeah. That question, and I think also related to that, is particularly for families that, you know, that are going to be having older children and things like that. Is there a risk?
Yeah, I think there will be a risk for pregnant women, and I think they're going to, that's why vaccination is so important. And I think that's why it's good that we're doing this slowly and gradually.
Yeah. John, any comments from you?
Well, look, there will be a splurge of cases that are related to the opening up. That's bound to happen.
Yeah.
Hopefully, there will be a better prepared population that is less naive to this virus, and that consequently will have a better capacity to fight it off so that they get mild disease. The children, look, that's a concern, but fortunately for us, still the vast majority of cases in children are mild. So consequently, although there are some that are going to get quite unwell, it's not going to be the same degree of risk as is in the adult and older population. So I think we will come to the point where we're talking about having, where the number of cases is just less relevant, and what we're really looking at is the number of people who are getting sick. And I think we're going to see that go right down as we get more and more people vaccinated. And I think actually Australians are generally pretty proactive about adopting first new technologies and also adopting things that are for the public good. And I think we'll see really high rates of vaccination in Australia. I think we're going to get well over the 80%. That's my prediction. I think there's still a lot of people getting vaccinated. There's still a lot of pressure on the vaccination facilities. And I think people are saying to themselves, you know, I've seen what's happened in the world, but it didn't seem maybe as real as it does now that I'm seeing it happen at home. And now we all know someone who's been affected, either overseas or here at home. And I think we're saying to ourselves, you know, I want more out of my life than sitting in my garden or on my balcony and calling to the people across the other balcony. I want a life that interacts with people. I want hugs again. I want to go out and have a meal and a glass of wine with some friends and whinge.
We've just got one other comment here before we finish up. What is the best source? Oh, we've got, no, just one more. What is the best source of information for parents and new families? Is it a case by case? Is it case by case depending on the pregnancy, or do you have a source to recommend?
Look, I think New South Wales Health is extremely reliable. We meet, all the newborn intensive care units and maternity units meet regularly and update, because this is a changing situation and things changed again with Delta. I think there's much more positive messaging around visiting, parenting, and this is extremely reliable. New South Wales Health, maternity and the pregnancies and newborn section. Excellent.
All right. Thank you very much, Nadia. Thank you, John. Thanks, everyone, for coming today and tonight. And I look forward to seeing you this Wednesday with 2 school principals talking about primary school and transitioning back to primary school. Thank you very much.
Thank you.
It's a pleasure.